So what happens with PEMFs, that the question becomes, what is the mechanism of action? What are some of the most important things you could do with PEMFs and how they work? In order to understand how they work and how to use a PEMF properly, you have to understand several different sort of aspects of the physics of PEMFs. And I'm not going to go into the physics in any kind of deep physicist kind of way, but if you understand these principles, then you'll have a much better understanding of how to use magnetic fields for the best effect. So one of the key things is intensity matters. So I learned this a long time ago. You can play with frequencies or you can play with intensities. Most people focus on frequencies. A lot of the low intensity systems in particular focus on frequencies because they're low intensity and they don't have anything to offer in terms of intensity. So they play with frequency. The high intensity systems can play with frequency too, but it's not as important as the intensity. So why is intensity important? So basically it's important because of something called Faraday's law. So a time varying magnetic field, in other words, a magnetic field that's pulsing, it's moving in and out, it's active, as opposed to a magnet, like a fridge magnet, which is static. That's not a time varying field, that's a static magnetic field. So a time varying magnetic field induces an electrical field in the body, in the tissues, whose magnitude, in other words, the amount of charge production, is proportional to its rate of change. So the time varying magnetic field has to change something, some parameters related to it. So the amount of energy produced in the body then is proportional to the rate of change of the magnetic field. And that is subject to something called dB/dt, or the skew rate. So I just call that dB/dt. All right, so dB/dt means dB is the change in intensity of the magnetic field. So B is the scientific term, shorthand, for magnetic field intensity. D is delta, or the change. So the change in the magnetic field intensity divided by the change in time, dt. So in other words, you cannot go from 0 magnetic field intensity to 100% without there being a time element. It's impossible to generate a magnetic field from 0 to 100 without having a time element. So you divide then the change in the intensity. Basically, if you're going from 0 to 100, let's say this becomes 100, right? And then you divide that by the amount of time it takes to do that. And usually that time is in seconds. That formula basically becomes the change in intensity divided by seconds. But the change in intensity of the magnetic field is usually in milliseconds or microseconds, or even in some cases nanoseconds, depending on the precision of the engineering. So the dB/dt can become really large. The symbols that are used for it are teslas per second. So Tesla is the size of the magnetic field. The 1 Tesla equals 10,000 Gauss. Most MRI machines are in the range of 1 to 12 Tesla. Extremely high magnetic fields. So they will have very high dB/dts. Now, another aspect of all of this related to charge production in the body is that the body is an electrolyte soup. We say the body is saline. We talk about saline. But it's not saline. It's really an electrolyte soup. And it's got proteins, and it's got fatty acids, and it's got carbohydrate molecules. It's got all sorts of things that all have charge associated with them, right? But particularly electrolytes. So the motion of the ions inside the body, that motion is created by the magnitude of change of the magnetic field. That changing magnetic field then induces and conducts charge in the cells, in the tissues, in between the cells. So it's interstitial and around the membranes of the cells themselves. So the PEMFs interact with the natural charge existing in the body. So the body basically is a battery, in a sense. It's generating charge all the time. And that battery has to be regenerated. Just like any battery does. You have to recharge it. And PEMFs basically interact with all that charge to create more energy in the body. So PEMFs can stimulate the body to produce the amount of charge, which then causes healing and other actions only to the extent the body's capable of it. In other words, the magnetic field doesn't do the work. It's just a stimulus for the body to do the work. And the body does the work by creating more charge. So if you have tissue that is needs to be healed, all of a sudden the body has to drive a lot of energy to that wound, to that scar, to that injury. And it's that increase in energy in those tissues that create the healing of that tissue. And a non-union fracture, for example, is a fracture that won't finish the job of healing. So you can have delayed healing of skin wounds and muscle wounds, and you can have delayed healing of brain wounds. You can have delayed healing of bones. Well, the bones stop healing, stop doing the job of healing because they get stuck. They don't have enough energy to finish the job of healing, whatever happened at that time. So now one of the other critical factors about magnetic fields is they drop off. Like, magnetic fields are a form of radiation. It's not ionizing radiation, like radiation therapy or the sun, right? It's non-ionizing radiation. Therefore, it is subject to the laws of physics relative to the loss of magnetic field over distance. That's common, well accepted physically in physics as a factor of magnetic field intensities as well. So magnetic fields drop off very rapidly from the source of the magnetic field. So this color back down here is 100 millitesla, and 100 millitesla translates into 1,000 Gauss. 1 centimeter into the body, 1,000 Gauss or 100 millitesla drops down to 24 millitesla. So 100 drops to 24 in 1 centimeter. Right? Huge drop in intensity of the magnetic field. And then as you move farther and farther away from the source of the magnetic field, those intensities drop off extraordinarily rapidly. So you have to account for the loss of the intensity of the magnetic field. And that's based on the inverse square law. So when radiation therapists are calculating the dose of radiation delivered to the body to radiate a tissue at certain depths into the body, they invoke and use the inverse square law to do that, to calculate that dose. When we use magnetic field therapy, we need to also calculate the dose into the body, where we're trying to deliver that dose, what our target tissue is for the magnetic field therapy. So that's based on the inverse square law. So you have Faraday's law that's causing charge production, but you need the intensity of the magnetic field to do that. And since the magnetic field drops off very rapidly, you have to then adjust your dosing based on the tissue, how deep away the tissue is from the source of the magnetic field. Another aspect of this.
Can I just interject before we move on to give people perspective? And I just want to say, is Newton credited with the inverse square law?
Yes. So it's called Newton's inverse square law. Absolutely correct.
And put that into perspective in terms of the types of ways that he was confirming that when today we have these modern devices. How did he confirm that in a nutshell with, the tools that he had?
It's a very good question, and I really can't answer it on the spot like this.
No, that's fine. That's fine. I do want to highlight something even more important, and I've had patients that have asked me this, and I think it's relevant to the inverse square law about both efficacy, as you mentioned, but also safety. I have patients that ask me, my rheumatologist told me my liver is going to be a problem if we do this therapy to heal some arthritis or help decrease the cytokines or inflammatory things floating around in the joint that are causing discomfort and dysfunction in joints. Obviously, we know that there is a huge drop off of energy that would make it very safe for some of the remote organs in the central core. What is your sort of adjunct thoughts on that in terms of making people feel more safe with something that they don't understand?
Let's hold that thought if you don't mind.
Sure.
Let's finish this discussion because I think we're going down to the need to determine the magnetic field intensity. And we could talk about the safety aspect of that because the magnetic field, one of the key aspects, well, we'll get into that because I think I have a slide about that as well.
Okay. Let's rifle through these and then we'll move back to that.
Research is showing that magnetic fields stimulate adenosine receptors. So the adenosine receptors on neutrophils are responsible for helping the body to deal with chronic inflammation. And research has shown that the optimal magnetic field at the adenosine receptor to decrease inflammation is about 1.5 millitesla, which is about 15 Gauss. You need about 15 Gauss optimally at the tissue to initiate the processes of healing chronic inflammation. So if your magnetic field is starting out at 1 Gauss or less, 10 times 0 is 0, 100 times 0 is 0, right? You get nothing, you don't have anything really there to work with. So most of the actions of these very low intensity systems that I've used myself and worked with and have given up on is that they don't heal deep enough in the body. Fortunately, as you say, magnetic field therapy is very safe, even at higher intensities than you need. So what happens here, even though the magnetic field intensity keeps going, there's no further action on the adenosine receptor. So basically, there's no harm either. So basically, it's wasted energy. That's all it is. It's just wasted energy. It's not harmful energy. It's wasted. So to calculate magnetic fields, for example, if you want to deliver 15 Gauss, 1.5 millitesla, 0.8 inches into the body, you need to have a 140 Gauss magnetic field to deliver 15 Gauss at 0.8 inches. At 2 inches, you need 540 Gauss at 4 inches into the body. So what's 4 inches into the body? The kidneys are 4 inches into the body, right? The skeleton, the spinal cord and system can be upwards of 4 inches into the body, right? So you need 1800 Gauss to go 4 inches to deliver 15 Gauss at 4 inches. Also, if you want to deliver 15 Gauss across the brain, across the skull, from one side of the skull to the other, you're going to need almost 4,000 Gauss, right, in order to be able to deliver that energy. Now, one of the key aspects of magnetic fields versus environmental magnetic fields, what I call them EMFs, which is the dangerous magnetic field. The dangerous magnetic fields are basically radiation. They're spread out into the atmosphere. They're broadcast. They're what we call open loop. They just broadcast out into the environment. But extremely low wavelengths are absorbed by the body. Microwaves are absorbed by the body. That's why we cook food in microwave ovens. When you see somebody's ear when they hold their their cell phone to their ear, that's microwaves. You're cooking the ear. It turns very red. When you look at the opposite ear, it's barely red, right? The natural ear. So the PEMFs, basically what we're worried about with Wi-Fi is microwaves, that they're absorbed by the body and they damage the tissues. PEMFs are created by a current flowing through a wire. So the thumb is the direction of the current. So that's subject to what we call the right-hand rule. So the magnetic field goes through everything around that coil, whether it's bone or muscle or wood or plaster. The only thing that it won't go through is metal. And what it does is it bounces around the metal. It doesn't get lost, doesn't get absorbed by the metal, it just bounces around it. But this is a closed loop system. So a magnetic field then basically is produced by a current flowing through a wire. That's the arrow here. And it produces an electric field. And the electric field at the same time produces parallel to it, perpendicular to it rather, a magnetic field. They're inseparable. An electric field produces a magnetic field. And so they're interacting all the time. To give you an example of this, you can see this in this GIF. As the magnetic field goes up, at the same time, as the electric field goes up, at the same time, a magnetic field is produced. So it's the electric field that drives the production of the magnetic field. So every time a current is flowing through a wire, you're producing a magnetic field. And that's the principle behind magnetic field therapies, is you're driving current into a wire that produces a magnetic field around it, and that magnetic field then goes into the body. So the body is completely transparent to a magnetic field. Completely transparent. And I can stop sharing. So because the body is completely transparent to a magnetic field, every time you put a magnetic field into the body, it goes all the way through. It does not stop in the body. doesn't get used up by the body, right? It loses intensity by itself of its own natural radiation, but it doesn't get used up. And therefore, it's amazingly safe. So as you said, you start off with a very high intensity magnetic field. It's passing all the way through. It doesn't stop. It doesn't get used up. And it's not high frequency, so it's not absorbed by the body. And because it's not absorbed, that's the critical factor behind therapeutic magnetic fields. It's not absorbed and can't heat and can't hurt.
All right. So that I think will give patients some comfort to answer those general questions. You kind of summed it up at the end. Now let's go down to specific applications. As you mentioned before, it's intensity related and also time related. And we were talking about this, and many of our physicians out there know that for years, I don't know how many, you would probably know, that we have used bone stimulators, both ultrasonic and electromagnetic. Those are the two different energies that are used, and each has their own advantages depending on which rep you talk to. That
their own basic characteristics. Yes. So ultrasound is very different. It is still electromagnetic energy in a sense, but it's ultrasound is sound. It's not PEMF. It's not magnetic. So therefore, it has different actions in the body. And like you use, people do use these pulse machines, right? That's sound. So sound has a different action in the body than electromagnetic.
Absolutely. So those have been used. I know that they've been around at least 35 years, because I remember getting out of my residency, we were aware of bone stimulators. So I've used them. I've seen the results with them. And these give people perspective how much energy they have related, compared to some of the units that we might either have as an office-based treatment like I have, or some of the units, for instance, that you're advocating that patients might be able to purchase for their home use.
If you don't mind, let me share again.
Sure.
I think I have a really important slide relative to that. This is a study done on those bone stimulators for non-union fractures. So again, if a fracture doesn't heal within 6 months, it's considered a non-union. And the FDA approved magnetic therapy devices that were about 18 Gauss. So it's a very low, relatively low intensity magnetic field. They approved 18 Gauss machines to heal these non-unions with a local application right over the spot of the non-union. And then what they did is they were recommending that these devices be used basically for about, I would say 9 hours a day. All right. And because they're recommended for 9 hours a day, people are not necessarily compliant. Those who did 9 hours a day of therapy with their FDA-approved machine for their non-union healed in about 112 days. In other words, they healed 76 days earlier than people who only did less than 3 hours a day. Those who did less than 3 hours a day took 6 months to heal, as opposed to 3 months. So in other words, double the healing time. So they healed about 76 days earlier. So the point you're making is the point I'm making is that you can do magnetic field therapy for hours at a time safely. And if you don't have you have a lower intensity magnetic field, it's going to take more treatment time very often. So if you have a higher intensity field, you don't need to treat 9 hours a day. You might be able to treat half an hour to an hour a day. So that's the science that was developed back in the 70s using very low intensity magnetic fields, because that was the science that we had at the time. So nowadays we know that higher intensity will drive healing to be much, much faster, safely.
Right. That's great stuff. Now there's a lot of other exciting things that are happening with regards to sleep, with regards to muscle recovery, regards to tendon and wound healing. Maybe touch a little bit on those. It's kind of a smorgasbord out there right now with electromagnetic energy, but maybe give some of the highlights that you're aware of.
So I published a book called Supercharge Power Tools for Health. I published two books. One is called Supercharge Your Health, which is more of a manual, and Power Tools for Health is the science. I have over 500 references. And in developing that book, reviewing the science for years and years, decades actually, I discovered there are at least 25 to 30 different mechanisms of action of magnetic fields in the body. And because there are that many, one of the actions is that you can actually entrain the brain. You can cause the brain to pace itself to the magnetic field frequency. But you can also heal the brain. So there's plenty of research to show that TBIs, brain injuries, are healed with PEMF therapies. They certainly improve function in people who've had brain injuries. So you can improve sleep. You can improve magnetic field, basically brain function. You can improve circulation. We talked about decreasing inflammation. You have a natural pain-killing effect of magnetic field therapy. It's now being discovered that magnetic fields also work on the endocannabinoid system. So cannabis, marijuana, works on cannabinoid receptors in the brain, and most of those are in the nervous system. So PEMF therapy actually works on the endocannabinoid system as well. So it has all these different actions, and in that Power Tools for Health book, I review the different actions that magnetic fields have. Circulation, reducing inflammation, stimulating stem cells. So PEMFs increase stem cells. They will help to regenerate tissue. That's how magnetic fields accelerate bone healing. So most wounds will heal in about half the time with magnetic stimulation than they would left on their own. All right, so you can accelerate the natural processes that the body has. So rather than leaving things to chance, when you do surgery, when I do surgery, I cross my fingers when the patient leaves the office. What do I do to help the person to heal their wound faster, better?
Well, I can tell you my daughter, who had her gallbladder removed, it took several days, unfortunately, out of VCU's healthcare system down where she goes to college, Medical College of Virginia, in conjunction for the surgeon and nurse to get back to her. So to your point, absolutely nothing.
Zero. Surgeons do zero to help you to recover because they don't know what to do. They haven't been trained that way. But we know that I'll tell you a personal anecdote. I had to have an elective appendectomy because I had a little tumor at the opening of my appendix.
Real quick, Doc, because I want to also be able to get a chance for how people can get more information. But
all right, well,
we're
basically,
about 3.5 minutes. So I want to
3 stab wounds.
Yep.
Friday afternoon. I treated with magnetic field therapy 24/7 for the next 48 hours, 72 hours. I was back to work on Monday.
That's fantastic. I want to share an anecdote. I have a 4,000 Gauss unit. I just got it 2 weeks ago. The body is a little strange sometimes when you have a sprain. I played soccer, my midfoot sprain, not the ankle, mind you, the midfoot, below the ankle. So the mid-tarsus joint. Right at kind of the center of where the arch is. I started observing this about 3 hours later, about watching a football game on this past Sunday. It was starting to throb so much, I could not bear weight on it. I went into the office because I own the machine. Why not? So I went in, I got there about 2:30, 3 o'clock. I did a 20-minute treatment while I was recording it for posterity. It's up on YouTube. Just search up Ben Pearl magnetic therapy for Sunday football injury. We call there's American football and Euro football. I was doing Euro football. Anyway, it decreased immediately the pain. So I would say maybe gone from a 6 to maybe a 3.5 right after treatment within the next 45 minutes. There was a little lag and then it felt like better. By that evening, significantly decreased. The next morning, okay, I could barely tell which one I had originally sprained. So it was an amazing thing. In the last 2 minutes, I want you to share how people can get more information and get connected to doctors that offer this unique solution.
It's kind of in terms of connecting with doctors who offer magnetic field therapies.
Work for themselves as advocates, because I know that you have you have a site. You can give out your website right now where people can get different types of units.
So drpawluk.com, that's DRPAWLUK, DRPAWLUK.com. Tons of blogs, tons of videos, tons of information. I have my 2 books that I strongly recommend. So if you want some more of the science, then you go to Power Tools for Health, written by Dr. William Pawluk. And for more practical advice in terms of how to pick a magnetic system for wherever you're trying to treat, then you go to the Supercharge Your Health with PMF Therapy book. Those are the 2 major resources. There are no national organizations that I think are credible enough to be able to recommend. So right now, most people are basically kind of on their own. Colleagues, of course, you can find your own colleagues who use PMF therapies, and that's a good source of information, sharing that kind of information.
Sure. I do want to tell you that I am on an advisory board for lasers. I have not been called to meeting since I've been on that advisory board. Now, laser is different than this therapy, and I've been trying to contact the FDA to see if they have an area or if they group that into the radiology study area. So that is something that I'm interested in participating with as one of the few clinicians in the United States like yourself that is actually using these to treat patients. Listen, we're going to hear more from you. We're going to probably circle the wagons in another 6 months, maybe less, to do a follow-up as this gains traction.